Good morning, all. I hope that you're all doing well today. My name is Ms. Lucas, and I'm the school social worker here at Yateman. Today, I'm going to be doing the training on mandated reporting and suicide risk assessment, along with harm to others assessment. So we're going to start with mandated reporting, recognizing, reporting, and responding to suspected child abuse. So on the agenda, today we're going to go over three things, which is to promote understanding state law surrounding mandated reporting of child abuse and neglect, to create awareness around child abuse and neglect, to learn the best practices on how to respond to a disclosure of child abuse or neglect. So let's start by saying who are mandated reporters. Every employee of SLPS is a mandated reporter. So that means me, you, and everybody who's in this building, we are mandated reporters. Also, medical personnel, including Christian Science practitioners, mental health providers, social workers, daycare worker, or any other child care worker, and law enforcement, including the juvenile office. So what is the criteria for determining child abuse or neglect? Based off the Missouri Department of Social Services Child Welfare Manual. Allegations of abuse and neglect to a child victim exclude spanking on buttocks as long as there are no marks. The child victim must be under the age 18 at the time of the call. It does not matter when the alleged abuse occurred. So what that means is if a child comes to you and they're like 12 now and they tell you about something that happened when they were 5 or 6 or even a year ago, as long as they're under the age of 18, you report it. You don't ask if it's been reported. Your job is to report it, because if they disclose to you, you go ahead and report it. Sufficient identifying information, which is names, address, to locate the family. Report, even if you think the report was already made. In cases of true emergency, contacting law enforcement may be the most appropriate first step, but we still have the obligation to make reports to the Child Abuse and Neglect Hotline. So depending on the situation, which is a case by case, you may have to contact the police, but always hotline it first, because it's mandatory that we, as mandated reporters, we are mandated to make a hotline. So we can do both, but that hotline must be made as well. In cases where allegations are made against staff, a report must be made before any internal process can be initiated. Employee relations is to be notified when an SLPS staff member is an alleged suspect of child abuse or neglect, and an internal investigation is initiated. What does the law say? All mandated reporters shall, upon finding reasonable cause, directly and immediately report suspected child abuse or neglect. No one person in charge or a designated agent shall be responsible for immediately making or causing such a report to be made to the division. So with that being said, is mandated reporting is on whoever the child is close to. It's not up to the teacher or the counselor or the social worker on one set party. If a child is close to you, it is your job under the law to report to the hotline, to report to CAN. So with that being said, this is not designated to one person or one party. If a child discloses to you abuse or neglect, you are to report it. Now, responsibility to make the report falls on each individual and cannot be relinquished to another staff member. What I just said is, like, if a child is reporting to you, you are to make that call. Ms. Lander and myself, we are here to help you and walk you through the steps if necessary, and help you get on the website, or help you make the phone call and make sure you have like all the information. But those who have the information about what the abuse and neglect is, they are the ones responsible for making the report. What else does the law say? No supervisor or administrator may impede or inhibit any reporting. So that means no one can get away in the way of reporting. Like, if you know that a child is being abused and neglected and they disclose that to you, nobody or nothing, regardless of their role, can stop you from making that report. No internal investigation can be initiated until a report has been made. Abuse is not limited to abuse inflicted by a person responsible for the child's care, custody, and control. Immunity and penalties. A person who reports in good faith is immune from criminal or civil liabilities. Immunity is provided regardless of the outcome of the investigation. Legally, your name is kept confidential. Failure to report is a Class A misdemeanor, which can lead up to a fine of $1,000 or 1 year in jail. Now we're going to get into recognizing the signs of abuse, which are neglect, physical, sexual, and emotional. Neglect. Failure to provide by those responsible for the care, custody, and control of the child the proper or necessary support, nutrition, or any care necessary for his well-being. The four main categories of neglect include physical, supervision, emotional, and educational. Possible signs of neglect. Physical signs: hygiene, lack of supervision, health care, nutrition, lack of or unsafe shelter. Behavioral signs: role reversal, unpredictable behavior, extreme behavior, developmental delays, attachment, and hoards for foods or belongings. Physical abuse. Physical abuse occurs when a person causes physical injury or harm to a child. Examples of abusive treatment: hitting with an object, kicking, burning, scalding, punching, threatening with a weapon. Possible signs of physical abuse. Physical signs include multiple injuries at different stages of healing, high incidence of accidents or frequent injuries, blunt instrument marks, burns, and bite marks. Behavioral signs: reacts with fear, states they are frightened, feel deserving of punishment, fire setting or other destructive behaviors, wears inappropriate clothing to cover their injuries. Sexual abuse. The use, persuasion, inducement, enticement, or coercion of any child under the age of 18 to engage in or having a child assist any other person to engage in any sexual explicit conduct by those responsible for the child's care, custody, and control. Can be physical or non-physical. Sexual abuse statistics. 1 in 4 girls and 1 in 5 boys will be sexually abused by their 18th birthday. Over 90% of all sexual molestation is committed by someone the child knows or trusts. The typical child molester abuses 117 children, and that's from the U.S. Department of Mental Health. Sexual abuse indicators that should be reported: bruises or unexplained bleeding in the genital area, exhibiting persistent sexual behavior, STI, and disclosure of sexual abuse. Traits linked to high-risk abuse potential. Here are some of the caregiver characteristics: unrealistic expectations, alcohol or drug abuse, domestic violence, isolation, depression, limited resources and or support. Traits linked to high-risk abuse potential, and these are the child characteristics: handicap or has special needs, birth unwanted or unplanned, stepchild, adopted child, reminder of offensive person or event. So now we're going to get into how to respond to a disclosure, and the acronyms we use is I CARE. I starts with the information: secure only basic information. Remember, our job as a mandated reporter is to suspect abuse, not to investigate abuse. Do not ask why questions because it places blame. Do not interview the child. There are trained professionals in the community designated to do this. Do not make the child repeat the disclosure to others or gang up on the child. Do not question the child in detail. Questions you should ask should include what happened, who did this, where, when. Just the basic kind of like, so when you're making your report, you can have such and such had this happen to them when they were at their dad's house around August or around the summertime. You want to have a little bit of like basic information because all the details and stuff are going to get filled in by the CAN worker who's assigned to investigate the case. And just note that younger children may not be able to accurately report a time frame because sometimes they don't just have the accurate concept of like time and dates. So listen to a child when they are in active disclosure, and as soon as you suspect abuse, report it. C is for calm demeanor. Let the child know that you are proud of them for coming forward. Make the child feel safe and protected. Remember, you are not angry at the child, but at what happened. Children can mistakenly interpret anger or disgust as directed towards them. Listen to and answer the child's questions honestly and use the child's language. So what you want to do when a child comes to you and they're able to disclose that they're being abused, you want to, one, be calm and assure them and like, okay, I'm here to listen. And they're like, I'm here to protect you, and make them feel like they're able to get it out, because it's a lot for a child to disclose that they're going through whatever it is they're going through or whatever happened to them is like, even I know for adults, it could be a lot to disclose this kind of information. Just imagine how much it is for a child who doesn't know why this is happening to them and may feel like it's somehow their fault. You want to protect them and kind of give them a space, a safe space for them to really explain to you what's going on because it's not their fault. Assure the child that what happened is not their fault. Abuse is never the victim's fault. Children cannot prevent abuse, only the abuser can. Some children may have conflicting feelings because when they were touched, it may have felt okay or it may have felt normal, but we know as adults what abuse is and what's not acceptable. So even though the kid may feel that, it's important for us to like let them know like, oh, that's abuse, and also let them know like it's not their fault and not blame them. But inform the child that they should not be ashamed with statements such as what happened was not your fault. You want to constantly assure them like it's not your fault, like this is not okay. I'm sorry this happened to you, but you want to make sure that they know that like it's not their fault and that they're not deserving of any mistreatment whatsoever. Then this is just some statistics. So most disclosures are made completely accidental according to Source and Sun and Snow. 74% are accidental disclosures, which is stuff abused by chance, and 26 disclosures are purposeful. So what that is being said is like sometimes kids are just gonna be talking and they're comfortable with you and they say something and you're just like, that ain't sound right, but it might just be because you're a teacher they trust or a staff member they trust and they just said it out loud. So when that happens is like, even if you have a great relationship with the child, it's important to be like, okay, what you just disclosed to me is abuse or neglect, and you're going to have to report it regardless of your relationship with the child. And like, I know it can be hard, especially when you care about the kids and you don't want to, you want them to trust you. And I know that dealing with can be traumatizing to some families, but at the end of the day, our job is to make sure these kids are safe and protected. And if we have to report abuse and neglect, that's what we have to do. That's our job. We're mandated to do that, and our job is to make sure these kids are safe and protected first and foremost. And when children do disclose, it may be months or even years after the abuse has occurred. Do not blame the child for waiting to disclose. So like I mentioned earlier, if it happened when they were 5 and they're 12 now, as long as they're under the age of 18, they disclose it, you report it. If you think it's been reported, still, you go ahead and report it. R, report the abuse. Report suspected child abuse to Missouri's child abuse hotline at this number. In cases of serious cases, you want to call the law. You want to call the law enforcement and then make a report. So when you're making a call, be sure to ask and document the work ID number, the report code, the response time, and the date time of the call. When making the call, be sure to leave your name. It is required as a mandated reporter, and leave a contact number. You can reach that after school hours, because sometimes you may make a report during the day and they may not contact you until 4 or 5. You have to make yourself available because they're going to just ask questions and follow up about like the report that you made, and probably ask if you have any additional concerns that they should be on the lookout for. E, encouraging counseling. Child abuse is a never-ending cycle. As 95% of adults who are abusers were abused when they were children. Counseling is very important for a child that has been abused, as well as for all non-offending caregivers. Help the survivor build a strong support network, including you. So it's like, even though they experience all this, you want to encourage them to get counseling and make sure that they're dealing with this in a healthy way. And you want to kind of like continue to be a part of their support system, because even though you made the report, doesn't make you less of a supporter or less caring about the child, but you want to make sure that like you're here for them and that you're going to provide support and be there. Long-term effects of abuse can include eating disorder, panic disorders, anxiety, low self-esteem, inability to build trust in relationship, diminished sense of safety, difficulty concentrating or focusing, conduct disorders, and post-traumatic stress disorders. That concludes the mandated reporting portion of this training. I'm going to go into the suicide and harm to others assessments. If you guys have any questions, feel free to email me, come to my office. I am downstairs across the hall. I'm next door to the teacher's lounge in room 211. You can also call me directly. My extension is 45617. So if you have any questions, just let me know. I'm always here to help where I can. And if I don't know, I can find somebody who does have the answers. So navigating suicide and harm to others in school-age children. So here are the objectives for this training. All district employees will receive information annually on current trends in youth mental health, well-being, and suicide prevention and awareness. Strategies to encourage students to seek help for themselves and other students. Warning signs that indicate a student may be at risk of suicide. The impact of mental health issues and substance abuse. Communication to students regarding concerns about safety and that asking for help can save a life.
Good morning, and please pardon the interruption, but could you please send the following students to Mr. Penn's room 213. Ashford, Nava Ashford, O'Shawn Boykin, Tiana Harris, Keon Hopkins, Jacob Macklin, Dion Moore, Cassidy Pugh, Cameron Shanks, Robion Smith, and Calvin Weaver. Thank you. Can you please send those students to Mr. Penn's room 213?
I want to say I was on 5. No, I was on 6. So the next thing is understanding limitations and boundaries for giving help and techniques to practice self-care. Identification of key school personnel who are comfortable, confident, and competent to help students at risk of escalated distress and suicide. So we're going to start off with suicide. So here are some stats. Suicide is the second leading cause of death for ages 10 and 24. Approximately 4,600 lives are lost each year. 81% of the deaths were males and 19% were females. The top 3 methods used in suicide of young people include firearm, 45%, suffocation, 40%, and poisoning, 8%. Girls are more likely to report attempted suicide than boys. Boys are more likely to use more lethal methods. Each year, approximately 157,000 youth between the ages of 10 and 24 receive medical care for self-inflicted injuries at the emergency departments across the U.S. 4 out of 5 teens who attempt suicide have given clear warning signs. All this information was gathered from the Center for Disease Control and Prevention. So here are some cultural variations. Native American and Alaska Native youth have the highest rates of suicide-related fatalities. African American females have the lowest rates of suicide-related fatalities. A nationwide survey of youth in grades 9 to 12 in public and private schools in the U.S. found that Hispanic youth were more likely to report attempting suicide than their Black and white non-Hispanic peers. LGBTQ youth seriously contemplate suicide at almost 3 times the rate of heterosexual youth. LGBTQ youth are almost 5 times as likely to attempt suicide compared to the heterosexual youth. Other suicide attempts made by youth, LGBTQ youth suicide attempts were almost 5 times as likely to require medical treatment than those of heterosexual youth. So now we're going to talk about suicide and mental health. The majority of children and adolescents who attempt suicide have significant mental health disorder, usually depression. Among younger children, suicide attempts are often impulsive. They may be associated with feelings of sadness, confusion, anger, or problems with attention and hyperactivity. Among teenagers, suicide attempts may be associated with feelings of stress, self-doubt, pressure to succeed, financial uncertainty, disappointment, and loss. For some teens, suicide may appear to be a solution to their problems. Depression and suicide feelings are treatable mental disorders. The child or adolescent needs to have his or her illness recognized and diagnosed and appropriately treated with a comprehensive treatment plan. So here are some warning signs and some statements. We're going to talk about direct statements and some indirect statements. So some direct statements may sound like, I feel like killing myself, or I'm going to kill myself. Whereas some indirect statements, which you would, when you hear this, you would ask them more things like, tell me more about that, and may result in a referral to the school social worker, myself, or Ms. Landon, the counselor. I don't care if I live or not. I won't be a problem much longer. Nothing matters after tomorrow. It's no use. I won't see you again, and I just want to die. So when kids say stuff like this, you kind of want to say, see where they head at, and it's like, well, tell me more about this. What's going on? I don't know. And if you're unsure or you're not able to get like anything more out of it, I would definitely refer them to myself and Ms. Landa, because sometimes we can just like, well, we know how to just get it out. So that's all I'm going to say. We know how to get the information out.